Hey everyone, Dr. Charlie Johnson, physical therapist here as sort of an extension of one of my other videos. So I've actually got some people that have reached out to me personally and found some significant relief with my self-shift correction. So I created a video on that. Maybe I'll try to tag it below or just kind of look through my videos. I think it's self-shift correction, okay? So basically this is for people who have a classic sign of a disc herniation, which is basically where their pelvis, the camera's going to move around a lot for this one, okay? The pelvis is kind of shifted to one side. So maybe, again, if you've been bent over for a while, doing something, you've been in the car, sitting for a prolonged period of time, you've tried to lift something up, you were tying your shoes, you tried to stand up, it was difficult to stand up, and you were kind of tilted to one side, okay? You would have what we would likely call a lateral shift. That's probably what's going on, is that you've had an issue occur with your disc and your hips are shifted to one side. So for the shift correction, you have to kind of get them back to midline. So I'm going to refer to my kind of outline here. You can't see it, but so if you're crooked and you look in the mirror, right, you have to get yourself to midline. So if you've been doing that self-shift correction, you've been getting relief, that's great. If you look in the mirror and now you are more center and midline, your hips aren't so crooked to one side, then the rule of kind of how we would treat back pain is that once you get central, then you have to restore the motion kind of in this front and backwards plane. And for the majority of people, it's actually going backwards that's most important. So what that means is after you have self-corrected yourself with the shift, okay, what you want to do is you want to try, okay, repeated kind of back bend. So your hands are going to be kind of on your hips, okay, in this area, and you're just going to be bending backwards as far as you can, okay? Make sure that you're not crooked before you do this. It won't work. You have to get yourself straight first, okay? So you should be doing the self-shift correction as instructed in the other video to get yourself centered first, and then you have to restore this motion. So work on standing back bends, okay? Maybe 10 times every couple hours, every hour, all right? Or another way that can really help get you to end range, and end range is really important, okay, is that you might want to go ahead and lay on the belly, okay, and do some press-ups where your hands are near your shoulders and you're pushing up, okay? This just helps kind of deload the spine and get you a little bit further. So then you would do that 10 times every couple hours. Now, what you have to pay attention to is that when you're doing these back bends, or even the shift correction for that matter, you don't want to peripheralize your symptoms, meaning you don't want your symptoms to go from, say, your back or your butt cheek further down the leg. If symptoms are going further down the leg, they're moving the wrong way. Stop, okay? If, as you're doing the repeated back bends or the shift corrections, okay, symptoms are feeling less in the leg and perhaps more intense closer up, maybe the buttock or the back, then that's actually a good sign. The back pain will actually worsen and the leg pain should actually lessen. So you want the symptoms furthest away to feel better, and then it should move up and slightly intensify, okay? So let's see here. So then the other thing a lot of times is that you have a nerve that's a little bit irritated, okay? So you want to find a way to sort of reinforce good posture, okay? A lot of times people with disc herniations have trouble sitting in the car, driving in the car, things like that. You want to find a way to reinforce good posture, but also get the nerve moving better in the leg, okay? So something to think about might be, I think I showed this in another video too, is that you sit on the end of something, and most people with disc herniations have a tendency to round the back. So rock the pelvis forward, sit up super tall, okay? Not just puffing the chest out. You actually have to twist the pelvis forward, okay? And what you're going to do is you're slowly going to maybe start with the leg that's pain-free, okay? And start straightening it. Now notice when I straighten it, I want to rock backwards, and so will you likely, okay? So you want to stay up tall and just straighten it. The goal is not to get it perfectly straight. The goal is just to work on gently moving the leg, but then also retraining your spine that every time the leg moves, it doesn't have to rock backwards. Notice, you can't really see here, but my toe when I'm straightening is pointed. Don't pull it up this way, at least to start. Start with it pointed, okay? So maybe you pop out maybe 20, 30 of them on the side that doesn't hurt. Then maybe go to the side that is a little bit sore and try that. Again, you don't want to significantly worsen symptoms. You just want to reinforce the posture, okay? So then after that, you're doing the back extensions. You're working on that, okay? If you can't do that seated because it's too painful, just like the back bends, maybe you can't do it standing because it's too painful, lay on the back, okay? So lay on the back, one leg straight, hold this leg and point the toe up towards the ceiling, okay? And then pull it down. Point the toe, pull it down. Point the toe, pull it down, okay? So that would be sort of another way to get the nerve moving better, restore some health to the nerve. But again, if you can't do it sitting, do it laying down, okay? Notice how I pointed my toe towards the ceiling as I went up and then kind of pulled it down as I went down. You're gliding the nerve, okay? Should be relatively pain-free, okay? The next thing to do is say, okay, so I want to reload this thing eventually and get back to life, lift things up again. So just do a squat unloaded, right? So a squat looks kind of like this, right? So then do that same idea on the table where don't poke your back up, drop it down, kind of stick your bottom out, and then push backwards. So you're basically in a squat position here, right? And back on up, push backwards, back on up, push backwards. The whole time, you're going to want to get to here and rock your pelvis, and everything's going to want to bend. Don't do that. Focus on keeping the spine tall. If your back wants to rock here, you stop, and you go back on up. Go here, stop. Don't let the back round, okay? Keep it tall and work on just maintaining a good spinal position as you rock back, okay? So here's what I'd say. Let's start with that, okay? If you're trying to recover from a disc herniation and the shift correction is working, you want to get back to that straight plane and start to reset it. Now, that's treatment. Activity modification. It's still going to hurt to bend, okay? It's probably still going to hurt to sit and drive. So if you're having trouble sitting and driving, you've got to get a back support, okay? Meaning, you've got to get some type of towel or something, okay, that you can fold in half, ideally a little bit bigger than this, a little bit wider, okay, about the width of your back. Roll it up super tight, okay? Maybe something about this width. Okay, when you sit in the chair, you're going to shove your butt all the way back and put this right along the belt line so it keeps your back really tall, okay? So then you're more upright. All right, should be right on the belt line, should keep your spine a little bit taller. If you're driving, okay, you're going to be, especially if you have pain numbness tingling down your right leg, you're constantly driving with that right foot, which extends the leg and causes stretch of the nerve down the leg. If it's sensitive, it's gonna hurt. So try moving your seat, say, an inch or two closer, okay, and then rather than lifting your leg to go from pedal to pedal, that activation of that muscle in the hip can actually cause a little bit of compression in the spine and irritation of the discs. So instead of lifting, okay, try to just rotate the leg, okay? So rotation of the leg, not lifting of the leg. So try these tips out, okay? Try to do less of what makes you feel worse, more of what makes you feel better, and get back to this plane through the back bends. Restore normal motion through the nerve, and then start to retrain the way that you move, okay? So try that out. Comment below if you need help. Email me at charliejohnsondpt@gmail.com. Thanks.